Summary of 21 CFR Part 820. Quality System Regulation, QSR. For medical devices. Presented by Learn GMP Inc. Introduction. 21 CFR Part 820 is the Quality System Regulation, QSR, for medical device manufacturers in the U.S. It outlines requirements for quality management systems that ensure devices are safe and effective. Below are the subparts of 21 CFR Part 820, with a brief description of each.
Subpart A, General Provisions. Section 820.1, Scope, defines the scope of the regulation and applies to all medical device manufacturers. Section 820.3, Definitions, provides key definitions used throughout the regulation. Subpart B, Quality System Requirements. Section 820.5, Quality System, requires manufacturers to establish and maintain a quality management system, QMS, to ensure products meet safety and effectiveness standards. Section 820.20, Management Responsibility, outlines the requirements for top management to ensure the QMS is effectively established, implemented, and maintained. Section 820.22, Quality Audit, requires internal quality audits to assess the performance of the QMS. Subpart C, Design Controls. Section 820.30, Design Controls, establishes procedures for the design and development of medical devices, including planning, inputs, outputs, verification, validation, design transfer, and design changes. Subpart D, Document Controls. Section 820.40, Document Controls, mandates manufacturers to establish procedures for creating, reviewing, approving, and maintaining documents related to the QMS. Section 820.50, Production and Process Controls, requires control over the manufacturing process to ensure devices conform to specifications. Subpart E, Purchasing Controls. Section 820.50, Purchasing Controls, requires procedures to ensure that purchased products and services conform to specified requirements. Subpart F, Identification and Traceability. Section 820.60, Identification and Traceability, requires devices to be identified throughout their manufacturing stages to ensure that traceability is maintained. Subpart G, Production and Process Controls. Section 820.70, Production and Process Controls, describes requirements for controlling the production processes to ensure that products meet specifications and quality standards. Subpart H, Acceptance Activities. Section 820.80, Acceptance Activities, mandates that manufacturers verify that the devices meet specifications through proper acceptance procedures. Subpart I, Nonconforming Product. Section 820.90, Nonconforming Product, requires manufacturers to establish procedures for identifying and controlling nonconforming products. Subpart J, Corrective and Preventive Actions, CAPA. Section 820.100, Corrective and Preventive Actions, requires manufacturers to establish procedures for investigating and resolving problems and preventing recurrence. Subpart K, Labeling and Packaging Control. Section 820.120, Labeling and Packaging Control, requires control over labeling and packaging processes to ensure the correct information is provided with the devices. Subpart L, Handling, Storage, Distribution, and Installation. Section 820.130, Handling, Storage, Distribution, and Installation, requires manufacturers to have procedures for handling, storing, and distributing devices to ensure product integrity and safety. Subpart M, Records. Section 820.180, Records, specifies requirements for the maintenance and retention of records to demonstrate compliance with the quality system. Subpart N, Servicing. Section 820.200, Servicing, requires manufacturers to establish procedures for servicing devices and documenting the servicing activities to ensure that devices continue to meet their intended safety and performance requirements. Subpart O, Statistical Techniques. Section 820.250, Statistical Techniques, encourages the use of statistical methods for assessing and controlling the manufacturing process. Subpart P, Device Design and Process Validation. Section 820.70, F, Design Validation, requires manufacturers to validate devices during their production and ensure that processes consistently produce devices that meet specifications. Closing remarks. Each subpart is designed to ensure that medical devices are manufactured under rigorous quality control processes, focusing on safety, efficacy, and compliance with regulatory standards. Compliance with Part 820 is essential for maintaining FDA approval for the marketing of medical devices. Thanks for watching our channel. Feel free to reach us at contact@learngmp.com.